Hi Sinead, it's great to have you on the sofa today. Looking forward to a great chat. So I'd love to hear what you do and where you're from.
So my name is Sinéad Kennedy and I am the head of Occupational Health and Wellbeing in Southern Region at Network Rail.
So what does Occupational Health and Wellbeing look like as such a large organisation which is both complex and geographically spread?
What does occupational health and wellbeing mean to us? It's actually trifold and people don't actually know this. So it's about management. So looking at occupational health hazards, making sure that our people are not exposed to them when they come into work with us. So physical, chemical, biological hazards. The second part of that is health. So how does work impact health? Fitness to work standards, drug and alcohol standards, and then flip that on its head. So what does work mean to health? So we're very interested in workplace stress, sickness absence management, return to work. And those are obviously very standardised, again, legal requirements. But what we're talking about today is well-being. Not the legal requirement, but very, very important. We put a big emphasis in Network Rail on personal health because we know that it means direct correlation to sickness absence, productivity, skill retention. It's very important to us.
Why is movement and physical wellbeing such an important part of your agenda at Network Rail?
Oh, it's so important, and I've touched on this already. So we have a quite high sickness absence rate in Network Rail, and from the data that we have, we know that it's nothing to do with work. It's purely non-work related reasons. So whether that's common cold and flu, or underlying health conditions, or out of work musculoskeletal disorders, or out of work mental health related problems, we know that's the reason. So early on, when we come into our control period of what we're going to do for our strategy, we put a massive emphasis on promoting healthy lifestyle choices, with the aim to benefit physical and mental health.
And what challenges do you face when you're trying to encourage the initiative you're putting in place with such a diverse workforce, such a geographically spread company?
So for me, it's about the comm strategy. So engaging people on the front line. Again, we have a very diverse workforce. We have people who work in maintenance or operations. We also have people who sit in support functions in offices. So making sure that we're setting the communication and engagement at the right line so it gets received by those individuals who want to engage with our events and get involved in the movement.
The Network Rail Active Hub. So can you explain how you introduced it within Network Rail?
Yeah, so again, back to the strategy, we wanted a sustained programme. We didn't want one hit wonders of monthly initiatives. And I'm not knocking those, but we wanted it to be sustained and have valuable outputs. But for me, it was about getting a movement campaign, which could be easy accessible via an application. But yeah, it was very important to make it as easy as possible. I have seen people roll out movement campaigns with the use of Excel spreadsheets, which are often cumbersome. And once it's extra work for individuals, people are not going to engage with it. So yeah, it was easy to use, and obviously working with yourselves, it's been fabulous. We have great discussions on what we're looking for. We have, we set the agenda and the scope, and then you go in and come back with a product, and then we agree what's going to be implemented moving forward, which is really helpful because obviously we're busy with what's going on and we have a small team, so it's great.
Yeah, one of our, as I've always said, our job is to not give you extra work, which is we try not to give you extra work.
Yeah, it's really appreciated. Yeah. It really is.
When you look back at the beginning, before you implemented the Active Hub, what were you hoping that would happen within Network Rail around movement?
So we were hoping initially to engage 500 people, and we exceeded that within the first 6 months. We were hoping that individuals would obviously engage with the events and then obviously get positive feedback from the workforce, which we have in the form of testimonials. People love it.
Have you seen employees step forward to lead, inspire others within the Total Active Hub initiative that you deployed?
Yeah, I've had many colleagues come to me and say that they love Total Active Hub, and they've gone out and arranged events outside of our flagship events. They lead that all by themselves.
And I think one of those reasons we often see is that when you implement like an always on programme, you're empowering people that this is what we believe in, and suddenly they're not afraid to raise their hand and go, I'd like to organise this or this, is that okay?
Yeah.
Because you've kind of empowered them to say, we believe in movement, we believe in whatever it may be, and you can see that coming out. So people in like High Speed One is just a great example of an organisation just making it happen
I do think, though, the easiness of it, like working again with Total Active Hub, it's a really intuitive, user-friendly application.
When it comes to embedding a culture of movement, what part do you think that leadership play in helping encourage more people to be more active?
Leadership, absolutely. They play such a vital part in setting culture. And that for me is as simple as taking part in the events themselves. So obviously, senior leadership team, I brief them on what's coming up, what events, times, dates, and getting those individuals involved.
You've moved away from doing one-off challenges to an always-on movement program.
Yeah.
You know, when we think about movement, we think around sometimes the gym, but the gym's not for everybody. So how is it supported, inclusive to everybody?
Yeah, so our first event, we did active movement. It was about not just running and walking, but you could go do a yoga session or a stretch, and that would still count as a movement on the application. So we thought about that from the first onset. If somebody had a disability or a limitation, that it would be inclusive to them and everybody involved.
So what impact have you seen so far with your employees? Any data, any stories, any feedback that you can share that you've seen within Network Rail?
For year one in Total Active Hope, we had a 90% engagement rate, and that's fabulous because obviously you can see the people, they want this, they're engaged with it, and obviously we can go back and do bigger, better for next year. Off the back of that, we've seen increased perception of occupational health and wellbeing. They know where to go to if they're looking for physical or mental health in the occupational health and wellbeing sphere. Now, there is a turn in the sickness absence data. We have seen a downward trend. We're going in the right direction. We're changing a culture of, sickness absence, productivity, presenteeism. So, yeah, I'm very happy with
Fantastic. Congratulations. That's amazing.
Yes.
How do you find, what benefits do you think having the Active Hub and the ability to look at data and the insights help you do your job and align to your future strategies?
You can actually physically demonstrate that people increased their movement post campaign. So that's really, really beneficial to go back on, return on investment, outcomes and whatnot. But yeah, that's excellent for us as an initiative.
When we've looked at the insights around the Network Rail Active Hub, we can see that those who started the programme and did no activities at the very beginning then went on to do 5.1 activities per week. So we've got the non-movers moving.
Yeah.
Can you just explain what the benefits of that is?
Non-movers now moving means, better cardiovascular health and better maintenance of blood glucose levels. We have identified a trend in the past where we've had high levels of type 2 diabetes, and that obviously helps to manage that. But not only is it good for mental health, you get your endorphins, but it's good for our musculoskeletal systems, so our muscles, our joints and our bones, which I've already mentioned is a problem for us. So it's all seen as a positive.
So this year celebrates 200 years of the railway industry in the UK. Why did you choose to create and implement a movement programme with Total Active Hub that went across a whole industry? What was the reason for wanting to do that?
Well, to celebrate the 200 years of the railway, but to tie in and use that celebration as a launch pad for our 200-mile event. I think there was an opportunity to work with our communications team and our HR team, to work with our EDI team, to get everybody involved, to get everybody moving on the back of the Railway 200, but also to have a charitable donation and partnership at the end of it.
So why should real organisations embed physical movement programmes into their wellbeing strategy?
I think embedding a movement campaign that is a sustained programme, promoting healthy lifestyle choices, will have a positive impact on the workforce. We know that the railway industry are not a particularly healthy workforce. We know that sickness absence is not work related, so the issues are actually outside of work. And by embedding well-being strategies for, including metabolic health and movement campaigns, will actually bring about physical and mental benefits in the future.
What's your favourite activity or challenge you've taken part in so far?
I'm really enjoying the Railway 200 actually. My team were 89th though.
We're 66, I think.
Yeah.
So
I need to get on and encourage my teammates to move a bit more.
One word to describe what movement means to you.
Routine. I think when I'm moving and I'm in a routine, I'm just a far better version of myself. When I'm not in that routine, I don't feel as good.
We're doing some great work. What you're doing at Network Rail is fantastic. So thank you for joining me, and we'll see you soon.
Thank you very much.